This time I'd like to recognize the gentleman from Nebraska for 5 minutes, Mr. Fortenberry, Vice Chairman of the Subcommittee.
Thank you, Mr. Chairman. Secretary, welcome.
Thank you.
Are you enjoying the new job?
Yes, thank you.
Well, apparently you are, and I'm grateful for your projection of an attitude of entrepreneurship and innovation as well as compassion for this essential mission. So thank you very much.
Thank you.
I appreciate that. In your opening statement, you also referenced the new idea that has emerged that has now been empowered by legislation of a unique public-private partnership that is going to happen in Omaha. I want to unpack that a little bit more for the committee just so that everyone understands how potentially transformative this could be. The community wanted to go on the point. Community leadership came to congressional leadership and said, you know, we've built housing for veterans, we've built housing for troops. Could we possibly participate through some charitable entity in updating and upgrading the hospital there, which is in serious need of not only a facelift, but serious innovation, modernization. So working with my predecessor, Congressman Brad Ashford, we got the empowering legislation to you. The community has committed about $30 million to build upon the money that had been set aside for a new hospital, about over $50 million. And we're going to move forward. I think it's exactly the model of what you're talking about in terms of creating the 21st century architecture for a modern VA that is looking to community resources when available to go not just into looking for charitable funds for donation purposes, but an integrated service environment, as you referenced earlier. This new facility will be an add-on to the existing hospital, ambulatory care facility, be proximate to Creighton Med School, as well as the University of Nebraska Med School, who you already work with. So the synergies there design will become a bit seamless, or as we say, the veteran won't know the distinction between the type of care that they're getting. They're just getting the best possible care under VA auspices using private sector resources, charitable monies that have gone into the clinic, because that's the objective. So I wanted to spend a little time just unpacking that further, and hopefully, given the very difficult, sad experiences we've had with watching burgeoning cost overruns, the Denver hospital being the poster child, that this way of proceeding forward is undoubtedly going to tap into a large pool of goodwill that exists out there in the country among charitable organizations and leadership in various communities to want to assist you in modernizing, innovating, and creating the types of partnerships that utilize the best of the private sector, but always under VA's auspices. So I'm excited by this, and I'm sorry to spend so much time on it if you want to comment on that. I also want to mention 50 miles down the road in Lincoln, we have a traditional, beautiful campus for a VA clinic. Similar type of dynamic is occurring where a charitable foundation with the city has agreed to build out veterans housing on the site of the old clinic. We're awaiting the decision as to what's going to happen with the new clinic, so if you could give us some update on that process, that would be helpful. But again, once again, the synergies being created with existing facilities, preserving traditional, beautiful architecture in proximity to the city's own private sector medical resources, again, is a new opening dynamic of what I hope is a new chapter of the VA. Third point, right quick, I've become aware and a little bit involved with a charitable organization called Project Hero. Your Undersecretary, Dr. Poonam Ale, has given a memorandum of understanding to your VA directors that they can partner with this organization using recreational activity, bicycling primarily, to be integrated into VA's services. Studies have there's metrics on this already showing improved healthcare outcomes, lower cost, sense of well-being, drops in suicides. A study comes out of Georgetown. Again, I just wanted to highlight that for you because I think this is one of those types of programs consistent with what I said earlier. It's been developed because of compassion and initiative by the private sector looking to partner with the VA, and we've got great opportunity here.
Right. Well, thank you. I think just briefly on your 3 points, the project in Omaha, Nebraska is exactly what I think we're looking to do in the VA, which is do things differently. In this case, we're going to build a new facility. It's going to be good for veterans and absolutely good for taxpayers. This is going to leverage the federal dollars in ways that in the past we wouldn't have been able to do before. And if it really wasn't for your leadership and support in getting this through legislatively and the whole way through, it wouldn't be happening. So I think this is a transformative model. We have 4 other sites that you authorized after Omaha, Nebraska that we can do. So I'm hoping that other committee members are listening because we have a list of 20 sites that now are eligible for this. I think this should become the way that we build a future modern healthcare system. So thank you for your leadership again on that. Secondly, on Lincoln, absolutely, we are moving forward with a new clinic there. It should be awarded this fall, and through the whole build and design process, even though I pushed really hard, probably the opening date is going to be in early 2020. So it takes a while to do this, but that is well underway, and it's really towards the top of our list. On your third point about Project Hero, you know, one of the great things about VA is that it defines healthcare much broader than just physical illness. It defines it as physical, psychological, social, economic, and an example of using sports and adaptive sports to help people get better and have a sense of well-being is something that, frankly, VA taught me a lot about. And this is a great example. And so we are very supportive of this and the other work around the country like this. And thank you for bringing this to our attention.
Thank you.
Thank you, Mr. Fortenberry.